Imagine a chance to sit down and talk to a physician for an hour and have them sort through your history, your medications, answer any of your questions for an entire hour.
That's what the comprehensive geriatric assessment is all about. Erin Breen has more on how it works.
Amy Kaylor is a very active senior. After all, she's got to keep up with Sutton.
Come on, silly boy.
She comes from a long line of creative and ambitious people.
My grandfather was a pocketbook maker in New York back in the 30s, and he made these beaded bags. My dad was training for the Olympics in swimming, and this is a lot of his medals. This is my great aunt. She was a bubble dancer.
And Andy wants to be around to realize all of her own dreams as well. So when she heard that Senior Care Plus was offering a free comprehensive geriatric assessment, she was in.
So when I saw this advertisement for this program, I thought, I've got a lot of little things going on in my body now, and I thought, it makes sense to have somebody that is just working with this population, might have a different perspective on what's going on with me and how everything kind of fits together and so on. I didn't know what to expect at all, but I thought, well, it's worth giving it a try.
It's a new program Senior Care Plus is offering to help patients and doctors get a big picture look at health for planning.
We have a team of geriatric specialists, physician, RN, medical assistant, pharmacists who look at the complete picture of the patient and then share those results with the primary care provider and make recommendations.
It looks at all aspects of aging.
The senior population has challenges that younger people don't have. And so the things we look at include vision and hearing screenings. We talk about medications. Most of our seniors are on multiple medications, so a pharmacist looks at those medications, determines are there things we can do to reduce the number of medications, or are there any medications that could potentially be harmful?
Combing through your entire medical history can actually turn up little inconsistencies that can make a big difference in care.
There were some inaccuracies, and that kind of blew me away as well, because I realized that decisions could be made based on what's written in there, and if it's not right, it could lead us down, a wrong path.
We also do a fall risk and safety assessment. A fall can be a devastating event for a senior, far more likely to have a fracture when that occurs, and it takes longer to heal.
I have a very rare heart condition, and one of the things that happens with this particular condition is it's easy for people to faint. At the end, he suggested that I should be using a walker when I'm out of the house, which shocked me. And he said, not because you can't walk, but if you had one with a seat, if you start getting lightheaded when you're out in the middle of a parking lot, you can sit down on the seat.
Because with healthcare, it's important to plan ahead.
We talk about mental health.
Family members who see a senior every day can sometimes miss subtle changes that happen over time, while an expert knows exactly what to watch for.
What's important about that is that for many of these conditions, including dementia that we're talking about now, they can be held in check and sometimes even reversed. And so that's a really important component.
Andy expects to be out and about with Sutton here and living independently for many years to come. And she says the Senior Care Plus comprehensive geriatric assessment is an important piece of the puzzle as she plans for her future.
It was a very good experience, and I've told several people that I thought this was really valuable. I mean, like you say, to go for free, be able to sit down with a physician for an hour and just really talk about me and what life could be like going forward and the challenges that I could, be facing. I thought it was very valuable.
The comprehensive geriatric assessment is free to all Senior Care Plus members. If you're interested in becoming a member or you want to schedule an appointment, just give them a call at 775-982-3112. For Aging and Awesome, I'm Erin Breen.